A stroke can happen anywhere in the brain. Not all strokes present the same. It's important to know the symptoms in order to identify all strokes and avoid delay in prompt care. In our last video, we learned the importance of assessing strokes using the enhanced FASTED tool. If you aren't familiar with this assessment, please refer to the link in the description to view part 1. Now we will practice using the FASTED scoring tool to determine the severity of the suspected stroke and communicate your findings to the hospital. It's important to keep in mind that even though some symptoms from the enhanced FASTED tool are not tallied as part of the score, they should still be monitored as possible signs of stroke. Remember to still look for sudden onset dizziness, terrible headache, vision loss, or changes in vision when collecting your stroke assessment points. Now let's learn how to assess a patient using the stroke scoring tool. First, we measure facial palsy. Ask the patient to show their teeth or smile. If both sides of the face move equally or not at all, no points will be added. If one side of the face droops or is clearly asymmetric, we will add 1 point. Next, we measure arm weakness. Ask the patient to extend both arms out in front of them with their palms facing up. Close their eyes and hold them there while counting to 10. If both arms remain up for 10 seconds, no points will be added. If the patient can raise both arms but one drifts down in less than 10 seconds, we will add 1 point. If one or both arms cannot be lifted or there is no movement at all, we will add 2 points. Next, we will look for speech changes. In order to determine if the patient is experiencing dysarthria, which is a difficulty expressing language, ask the patient to repeat the phrase, "You can't teach an old dog new tricks," and listen closely to hear if any slurred speech is present. Then, we will assess for expressive and receptive aphasia to calculate the score. To check for expressive aphasia, which is the loss of the ability to speak, ask the patient to name 3 common items. If they name 2 or more correctly, no points will be added. If the patient only names 1 item correctly, or none at all, we will add 1 point. Next, we will check for receptive aphasia, which is difficulty understanding speech. Ask the patient to perform a simple command, such as, "Show me 2 fingers." If the patient can follow the simple command, no points will be added. If the patient is unable to follow the simple command, we will add 1 point. Next, we need to check for eye deviation. Have the patient look left, then look right, and watch both eyes closely. If there is no deviation and the eyes move equally to both sides, no points will be added. If the patient has a clear difficulty when looking to one side, we will add 1 point. If the eyes are deviated to one side and do not move to the other side, we will add 2 points. Next, we will check for denial or neglect of a body part. Do not perform this part of the test if expressive or receptive aphasia is present. First, we will check for anosognosia, which is when the patient is cognitively unaware of their own disability, by showing the patient their affected arm and asking, "Do you feel weakness in this arm?" If the patient recognizes the weakness in their affected arm, no points will be added. If the patient does not recognize weakness in their affected arm, we will add 1 point. Then we will check for asomatognosia, which is when the patient has a loss of recognition or awareness of a body part. Show the patient their affected arm and ask, "Whose arm is this?" If the patient recognizes their weak arm, no points will be added. If the patient does not recognize their weak arm, we will add 1 point. That will complete the scoring. Now we will tally up all of our points for a total score. A FASTED score of 4 or higher could indicate a severe or large vessel occlusion stroke. A large vessel occlusion, or LVO, is a cerebral occlusion in the internal carotid artery, ICA terminus, middle cerebral artery, M1 MCA, vertebral artery, or basilar artery. Now let's try this scoring tool on 2 different possible patient scenarios. Robin is experiencing a posterior stroke and calls 911 complaining of sudden onset dizziness and blurred vision. Even though these symptoms are outside of the score, EMS recognizes these as signs of possible stroke and activates a stroke code. While en route, Robin's symptoms change, and the FASTED tool is applied again. EMS discovers Robin has developed slurred speech and confusion. She has difficulty repeating back the phrase and can only identify 1 out of 3 objects. When asked to show EMS 2 fingers, Robin is confused and unable to follow the command. EMS marks down a point for both expressive and receptive aphasia. They pre-notify the hospital of the last known time well being 1 hour ago, and a mild FASTED too. EMS also communicates an estimated time of arrival and blood glucose reading. The stroke team is able to give Robin an IV clot-busting medication timely after imaging. She is discharged home after 24 hours of frequent monitoring post-thrombolytic administration. Peter experiences a sudden loss of consciousness and a coworker calls 911. Upon EMS arrival, Peter regains consciousness, and when assessed using the FASTED tool, reveals symptoms suspecting a left middle cerebral artery stroke. They ask Peter to smile and discover a right facial droop, giving him 1 point for facial palsy. They then ask Peter to hold both arms up with palms out in front of him, and close his eyes while counting to 10. Peter's right arm immediately falls, and he begins to complain that both his right arm and leg feel weak, giving him 1 point for arm weakness, but 0 points for denial or neglect. They notice that his speech sounds slurred, so they ask him to identify 3 common items, then to show them 2 fingers. Peter is unable to complete either command, giving him a point for both expressive and receptive aphasia. EMS then examines Peter's eyes. It's apparent that he has a left gaze preference towards the same side as the injury and receives 2 points. Tallying up the score, Peter receives a high total of 6 points. EMS promptly pre-notifies the hospital of a severe FASTED 6 with a high likelihood of a large vessel occlusion. Upon arrival, the stroke team gives Peter an IV clot-busting medication and performs a thrombectomy for clot removal. Peter is discharged for home with outpatient physical therapy for mild residual hand weakness. When dealing with a stroke, time is of the essence. Understand the importance of the enhanced FASTED stroke assessment tool and FASTED scoring tool in order to identify all strokes. By understanding these tools and working together, we can avoid delay in prompt care.